and thank you for attending our debate. Today we're going to be talking about person first versus identity first language. Here's a quick overview of what we're going to be going over today. How does one define themselves? How do we define others? The question is complicated for anybody. However, for an individual working in ABA, it's slightly more complicated. For years, clinicians have favored a certain way of describing their patients. For the patients, however, the preference might be opposite. There's a fundamental question in the field of ABA. Should we say autistic person or person with autism? The question of how to refer to individuals diagnosed with disabilities has been a subject of research and debate, especially in recent years. For the purposes of this debate, a focus will be put on individuals diagnosed with autism spectrum disorder. Although this could be considered a semantics debate, the implications of the use of person first versus identity first language range, including changing the way that society views somebody diagnosed with autism, how people vote on public policies, the way that clinicians practice, as well as the threat of stigma towards these individuals from both society and themselves. In person first language, the user does just that. The person comes before whatever diagnosis they have, such as child with autism. Alternatively, in identity first language, the person and the disability are one and the same, such as autistic child. Here's a brief history on how those with autism have been addressed over the years. Over the years, people diagnosed with autism have been referred to in several ways. Oftentimes, these ways have produced stigma and harm on their community. The use of person-first language began in the 1970s as a way of discontinuing the use of language that indicated a person was their disability. In 1974, a self-advocate attending a disability rights convention stated that he was tired of being called retarded. We're people first. The hope was to do away with language that continually marginalized and stigmatized people with disabilities. By 1990, the use of this language was implemented in the Americans with Disabilities Act, and then again in 1997 in the Individuals with Disabilities Education Act, or IDEA. This represented a shift towards person-first language within clinical practice. However, in recent years, scholars and advocates have pushed for the use of identity-first language in order to accomplish the very thing that person-first language sought out to do originally. Overall, clinicians are generally trained to use person-first language. Those advocating for identity-first language oppose this idea. In this debate, we will hear from both sides. First, I'll hand it off to Brenton and Chloe in the person-first group to present their case.
Our first argument towards person-first language is that people with disabilities have had to fight hundreds of years of assumptions, stereotypes, and irrational fears. Stigma around disability has led to social and economic marginalization of generations of Americans with disabilities and has left them in a severe state of impoverishment for years and years. In the 1800s, people with disabilities were considered meager, tragic, pitiful individuals, unfit and unable to contribute to society except to serve as ridiculed objects of entertainment in circuses and exhibitions. They were thought of as abnormal and feeble-minded. Many had to undergo sterilization. They were forced in institutions and asylums for most of their lives. The segregation kept them away from people who looked down on them and feared them. People made assumptions that individuals with autism were an economic burden, incapable of having moral selves, or are selfish or egocentric, similar to animals, unable to read the minds or understand others, and less than human in need of fixing. Media stereotypes were mostly negative. 8 of the top 10 stereotypes related to or associated with autism are rated negatively, some being difficult personalities, awkward, withdrawn, obsessive, and low intelligence. The People First movement began in 1974 at the first self-advocacy conference. At the conference, they advocated for people to be placed before their disabilities. This sought to empower people with disabilities by placing emphasis on individuality and personhood rather than impairments. This pushed other movements such as children receiving free and appropriate public education in the least restrictive setting, and states requiring protection and advocacy programs. From these big movements, people with disabilities in institutions decreased and integrated community opportunities increased. These advances shifted how communities viewed people with disabilities. The change in how people with disabilities are viewed began to make a change in the actual language and terminology. Language has the ability to change how we think and how we view the world. In 1992, the APA led the movement towards the use of person-first language. This came as an alternative to labeling people, as labeling leads to stigma and negative attitudes. It intended to focus on the person rather than the diagnosis. When we decrease the stigma of disability, greater equality exists. The history of stigmatization and the movement are important factors in determining proper terminology to use. This movement created so much good in the community, and this progress should not be lost, forgotten, or reversed.
So despite the original intention of person-first language, research has shown that it is not actually effective at decreasing violence towards the autistic community. Botha et al. States that violence is still occurring against autistic people despite the use of person-first language. Instead, it can be argued that person-first language perpetuates violence and stigmatization by separating the person from autism, driving a wedge between the two, and in turn making autism something bad or something to overcome instead of an integral part of who these individuals are.
Another reason I feel person-first language is superior is because an individual is a human first with many characteristics in addition to having a disability. People are human beings. We are not defined by our obstacles or impairments. There are some different styles of person-first language. Two common ones are person with autism and person on the autism spectrum. Person on the autism spectrum is actually the most preferred style, as it is typically associated more positively, like person on the soccer team, person on vacation, or person on the A honor roll. It states that they are a member of a group of people. By placing the person before the disability, person-first language emphasizes the unique combination of strengths, needs, and experiences that might be different than others with the same diagnosis. Emphasis is put on being a person first, and all people should have equal rights and opportunities. The language form shifted from people being called autistic, epileptic, etc., which were derogatory and dehumanizing, including thoughts that a person with a disability is less than a person. Beyond the autism diagnosis and its negative as well as positive associations, there is a unique person whose human rights should be respected. It's important for individuals on the most impaired end of the spectrum, maybe who are nonverbal or unable to self-advocate, people who are more at risk of being treated as less than a person. The people with challenges as such may relate more to the "we are people first" movement and terminology rather than the autistic pride narrative. When remembering people first language, this visual has good examples of what to say and what not to say. So, what sounds better to you? Handicapped or disabled people, or people with disabilities? Midget or dwarf, or a person with short stature? Blind or suffers from vision loss, or a person who is blind or visually impaired?
While autistic individuals are human first, and that should be recognized, of course, they also have a diagnosis that affects every part of who they are, and that should also be recognized. According to Crocker and Smith, it affects every area of life. It is who I am, it is a characteristic, and it should be accepted. That being said, autism is not a bad word, and stating that they are autistic does not make them less worthy of rights. Society may have pushed this upon autistic individuals, but they can reclaim being called autistic while still demanding the rights they deserve. One group that has made their preferences known are members of the deaf community. Notably, the deaf community has chosen not to embrace the notion of person-first language, but has embraced identity-first language. This approach views the individual's disability as an integral part of the individual's identity. So the deaf community often will prefer to be called a deaf person, as it spreads awareness of their disability. As always, we should listen to the members of the community of what the members of the community prefer and defer to that.
There was a study done in 2003 that surveyed Dutch adults with autism, as well as Dutch parents of children with autism. That results showed that the parents, as well as the adult people with autism, strongly preferred person-first language. The results here show that from 1,026 adults surveyed who have autism, 68% of them preferred person-first language. They prefer to be called either people with autism, or someone with Asperger's, or someone with another similar type of developmental disability. Also, the parents of the children with autism had a strong majority of 82.50% of people who preferred that their children be called people with autism. And it strongly showed that 79.9% also preferred it if they had Asperger's or another similar developmental disability. It is always important when working with people with disabilities to consider the culture and language. It is the ethical thing to do when addressing those who have been diagnosed with autism or any other disability. An important code from the BACB is Ethical Code 1.07 that says it is important to have cultural responsiveness and diversity when working and engaging in a professional setting, such as working with those with autism or other disabilities. As a behavior analysis, it's important to evaluate your own biases and to have the ability to address the needs of individuals, depending on their backgrounds, their gender, their culture, immigration status. It is important to always consider any of these things when working with individuals with disabilities. And it's also important for behavioral analysis to evaluate those that they train and those that also they work with, just to make sure that they also check their biases as well as their own. In this video, I have an example from a 7-year-old boy named Chase, who is from Detroit. In this video, it shows him being addressed as a person with autism consistently, and he is someone who is doing just fine being addressed that way.
April is Autism Awareness Month, and in that spirit, we want to introduce you to a very special young man named Chase.
7XC News reporter Kim Russo took to Twitter asking if you would like to see more happy and positive stories right here on the news.
This one is about Chase, the little boy who couldn't communicate with the world. His parents trying one last therapy in hopes for change. The results?
Happy birthday to you. Happy birthday to you.
Here's how it happened.
Imagine living every day, not only unable to speak, but to make sounds. This is video of therapists giving Chase, a little boy from Macomb County, a way to communicate with technology when he was 3 years old. The idea is once you teach someone how to communicate one way, sometimes speech follows. A year later, Chase had made some progress, but not as much as hoped. His parents had been told by some that it was getting to be too late for him to learn.
There was a point where we thought at 4, if he's not talking, there's a good chance he's not going to talk.
We're like, well, he's going to be nonverbal. They decided to try one more thing. They came here to the Kaufman Children's Center for an evaluation. experts here recognized Chase didn't just have autism, he had severe apraxia. That meant his brain could actually organize the words, but he didn't have the motor ability to say them. This called for direct treatment. They taught him sign language in a fun way to expand his ability to communicate. At the same time, they treated his apraxia.
And they had to actually put tools in his mouth to get the sound, to even get his position of his jaw correct.
When Chase first came to us, he had no vocal imitation. He couldn't imitate any sounds.
Hamsters?
Now to see him today, he can talk in sentences. He has a sense of humor.
Happy birthday to you. Happy birthday to you.
It's just like a miracle.
Nancy R. Kaufman owns the Kaufman Children's Center. She says miraculous things happen when the right therapies are brought together.
It's about the techniques. And so we may be doing something that isn't working for the child, and we may not have known that there was another way to approach the issue.
Chase's parents are sharing their story because they want other parents of children who are nonverbal to know that sometimes a change of therapy can make all the difference.
This journey has just been amazing.
When you see, I see a werewolf twinkle around me.
It's long. It's tough. But you got to stay with it.
Surprises us all the time. So you got to stay positive.
In West Bloomfield, Kim Russell, 7 Action News.
Wow, and you can see the tears in their eyes, and boy, I can't wait until that young man grows up. I mean, he's a little boy now, but I mean, with the progress, who knows what will happen.
True and very special, right? And happy for that family in this progress. And thanks to Kim Russell for bringing it.
Inspired a lot of people today.
Recently.
As you can see, he was identified as a person with autism or autism spectrum disorder a few times, and he's doing just fine.
April is autism.
So the previous statistics and study only show what Dutch individuals prefer. So we cannot generalize these findings and assume that they are true for individuals from other countries. Each country has their own cultures and belief systems, which affect their preferences, and it's important to be cognizant of that fact. For example, a study conducted which surveyed UK residents found that autistic people prefer identity first language, and then the next slide shows a graph that represents the preferences of 4 different groups consisting of autistic individuals and other stakeholders. So autistic individuals preferred the terms autistic or autistic person over person with autism. Interestingly enough, other stakeholders such as parents and professionals reported to use language such as person with autism and on the autism spectrum. However, as BCBAs, we have an ethical obligation to put the wants and well-being of our clients above anything else. And as such, we should be using the terms that they prefer when addressing these individuals.
Our key takeaway points for why we prefer person-first language is because the terminology was created to dehumanize and increase the violence against people with disability, including those with autism. The 1974 Self Advocacy Conference places emphasis on their individuality and personhood rather than their impairments. By placing the person before the disability, person-first language emphasizes person's unique combination of strengths, needs, and experiences. In the survey taken on the person-first preference or identity-first preference from the Dutch results, we saw that an overwhelming majority of them, the adults with autism and the parents of children with autism, strongly favored person-first language.
Now that we've heard from the person-first group, we will consider the identity-first group's case. Holly and Rachel are here to present a case for the use of identity-first language.
So our first pro for identity-first language is that autism is a central identity-defining feature that cannot be separated from the individual. That's coming from Vivanti 2020. Autism defines every part of an autistic individual, so that should be recognized in the language we use. In our discussion of identity-first language, I will frequently reference Jim Sinclair, Jim Sinclair is an American autistic activist and writer who is widely considered to be the founder of the autism rights movement, and he often speaks about the importance of identity first language. He has autism himself and was the first autistic person documented to reject person first language. So he says that autism isn't something a person has or a shell that a person is trapped inside. There is no normal child hidden behind the autism. Autism is a way of being. It is pervasive. It colors every experience, every sensation, perception, thought, emotion, and encounter, every aspect of existence. It is not possible to separate the autism from the person. And if it were possible, the person you'd have left would not be the same person you started with. That being said, you cannot remove the autism from a person, so it's better to fully describe them as an autistic person. So this is a great visual actually created by Jillian Enright, another autistic individual, and it provides a great representation of how different phrasing may literally be taken by an autistic individual. So suffers from autism, the suffering, it's almost like a knife to the head, like in her example. On the spectrum, it's like you're on something, you're on the spectrum. Person with autism, that's almost like you're holding an accessory. You have an accessory that is autism. But an autistic person, it encompasses everything, and it colors your, how she puts it, it colors your brain, it colors every part of who you are. So Enright also says that many autistics do not feel they are disordered. So ASD or spectrum disorder does not sit well. Note that when people speak about having a condition, it is usually in reference to something negative. Somebody might have cancer or asthma or diabetes because those are medical conditions that negatively impact a person's life. That being said, autism does impact a person's life, but it is not necessarily a negative thing and should be embraced.
So it is important that we touch on ABA therapy, which is the most common intervention to help those on the spectrum learn skills and become more equipped in life. When you say it can't be separated from the individual, you're downplaying the effects of ABA. And then this is a story about Jake Excorn. When young Jake Excorn was just 2 years old, he didn't talk, make eye contact, or follow instructions due to his autism diagnosis. In 2015, when this article was written, Jake was a fully functioning 19-year-old freshman at the University of Michigan. Jake started ABA therapy at age 4, where he sat in a chair for 40 hours a week, taking lessons and slowly making progress. He has few memories of this part of his childhood, but claims he has recovered.
So the language we use has implications on the social perception of a topic. Botha et al. Did a study that argues that the person first language is typically used to signify an illness or a pathology, such as a person with cancer. This perpetuates stigmatizing views that autism is something negative or something that needs to be cured. In contrast, desirable attributes are commonly expressed before the noun. For example, we would say a smart child. This comparison supports the use of identity first language, such as saying an autistic person. By using this terminology, our language is neurodiversity affirming and supporting the view that autism is not something to be ashamed of, but instead something that is an integral part of who the individual is.
When using person-first language, it involves intentionality, meaning it helps clinicians check themselves, it makes them more intent on their own biases, it helps them realize them, and it helps them not to stigmatize the individuals that they care for, such as those with autism or any other type of disability. The BACB has Ethic Code 1.10 called Awareness and Personal Biases and Challenges, which checks behavior analysis to maintain their awareness of their own personal biases or challenges, such as their mental or physical health conditions, legal, financial, or any other challenges that they're facing that may interfere with their effectiveness of their professional work. Behavior analysis take appropriate steps to resolve interference, ensure that the professional work is not compromised, and document all actions taken in this circumstance and the eventual outcomes. A study from Illinois State University in 2023 surveyed autism stakeholders in the US and found that families and friends of individuals diagnosed with autism preferred person-first language when they were polled. Additionally, autism professionals were likely to support person-first language in clinical practice. As professionals working within the field of autism, these individuals are to be held to the standard of BACB ethical codes. Within these, the core principles of the benefiting others and treating others with compassion, dignity, and respect are relevant. These professionals should be working to do no harm and protect the rights of their clients above all others. The National Institute of Health recommends that professionals utilize person first and destigmatize language or emphasize the person rather than their diagnosis. In the National Institute of Health Style Guide, they say to err on the side of person first if the person or group is unable to choose identity first language. Their use of person first language, much like the use of family and friends of people with autism, is a sincere effort to do the least harm by referring to individuals based on their being a human before all else.
So there have been multiple studies and surveys done to try to determine the preferred terminology among the autism community. The first study that I'm going to talk about polled autistic individuals and found that they preferred identity first language terms to refer to themselves and others. Additionally, there was a study conducted which found that autistic and autistic person remain the preferred term among autistic individuals. In contrast, they also found that professionals who work in the autism community were more likely to support and use person-first language. However, according to the ethics code, BCBAs have an ethical obligation to act in the best interests of clients, support client rights, and do no harm. Therefore, BCBAs should support their clients' rights by using the language that these individuals prefer. We should listen to autistic voices, and it has been shown that the most preferred term is autistic person.
So the claim is that the majority of people prefer autistic person. Doesn't really matter what is the most preferred or what the majority think. It is necessary that each voice is heard separately and each person's feelings and perspective are considered. The BACB ethics core principle states to treat others with compassion, dignity, and respect, promoting self-determination and respecting personal choices. And Ethics Code 3.01 states, behavior analysts act in the best interest of clients, taking appropriate steps to support clients' rights, maximize benefits, and do no harm. And they can do this by listening to each individual voice.
Okay, as Rachel said, we should listen to autistic voices and we should defer to the people who are the greatest stakeholders in the autistic community, which are autistic individuals. So going back to Jim Sinclair, the autistic activist, he wrote an essay about why he dislikes person-first language. And I want to read this whole essay as I feel it is important to hear directly from autistic voices when discussing these issues. And these are the anecdotal and personal stories we should listen to when deciding which language to use. So he starts, I am not a person with autism. I am an autistic person. Why does this distinction matter to me? 1, saying person with autism suggests that autism can be separated from the person, but this is not the case. I can be separated from things that are not a part of me, and I can still be the same person. I am usually a person with a purple shirt, but I could also be a person with a blue shirt one day and a person with a yellow shirt the next day, and I would still be the same person because my clothing is not part of me. But autism is part of me. Autism is hardwired into the way my brain works. I am autistic because I cannot be separated from how my brain works. Number 2, Saying person with autism suggests that even if autism is part of the person, it isn't a very important part. Characteristics that are recognized as central to a person's identity are appropriately stated as adjectives and may even be used as nouns to describe people. We talk about male and female people, and even about men and women, and boys and girls, not about people with maleness, people with femaleness. We describe people's cultural and religious identifications in terms such as Russian or Catholic, not as person with Russianity or person with Catholicism. We describe important aspects of people's social roles in terms such as parent or worker, not as person with offspring or person who has a job. We describe important aspects of people's personalities in terms such as generous or outgoing, not as person with generosity or person with extroversion. Yet autism goes deeper than culture and learned belief systems. It affects how we relate to others and how we find places in society. It even affects how we relate to our own bodies. If I did not have an autistic brain, the person that I am would not exist. I am an autistic person because autism is an essential feature of me as a person. Number 3, saying person with autism suggests that autism is something bad, so bad that it isn't even consistent with being a person. Nobody objects to using adjectives to refer to characteristics of a person that are considered positive or neutral. We talk about left-handed people, not people with left-handedness, or about athletic or musical people, not about people with athleticism or people with musicality. We might call someone a blue-eyed person or a person with blue eyes, and nobody objects to either descriptor. It is only when someone has decided that the characteristic being referred to is negative that suddenly people want to separate it from the person. I know that autism is not a terrible thing and that it does not make me any less of a person. If other people have trouble remembering that autism doesn't make me any less of a person, then that's their problem, not mine. Let them find a way to remind themselves that I'm a person without trying to define an essential feature of my personhood as something bad. I am autistic because I accept and value myself the way I am. And I feel like that is a very powerful essay that concludes all the points that we believe support identity first language. Sinclair seems to believe that person first language is used to make neurotypical individuals feel better about themselves. But as he stated, that's their problem, not his. And autism includes every part of an autistic individual and is not a bad thing. It is just simply the way it is and who they are.
Thank you to all of our participants for the debate that we've had. Here are some questions from the audience that we've gotten. The first one is, what do the BACB ethical codes say that may help guide our understanding of people first language versus identity first language?
So we have put on the screen 4 of the most relevant codes that we think are relevant to this topic. So code 1.03, behavior analysts are accountable for their actions and professional services and follow through on work commitments. Code 1.08 states that behavior analysts do not discriminate against others and behave in an equitable and inclusive manner. Code 3.01 states that behavior analysts act in the best interests of their clients and support clients' rights and do no harm. Code 3.08 states that behavior analysts place the client's care and welfare above all others. So all of these codes encompass the idea that the client comes first, and listening to client preferences and how they want to be addressed, and then honoring that preference should be the highest priority when it relates to the identity first and person first language debate.
Thank you, Holly, for answering. Thank you, Rachel, for answering that question. Our second question is, how might a BCBA approach this discussion with a client and his or her family?
So we believe it is most important to accept whatever choice the client makes about terminology. For caregivers, you may provide both sides of the argument and let them decide if their client is unable to choose for themselves. We can educate families, but we cannot make a decision for them. Typically, when talking to the client, you would call them by name and you don't have to attach a label. And when talking to parents, you would refer to their child by their name or your son or daughter. It is unlikely, unnecessary, and inappropriate to say your daughter with autism or your autistic daughter when referring to their child. In a situation where this does come up, say you are going to the doctors and you have to give them the diagnosis, it would be respectful to ask the client or parent their preference beforehand.
Thank you, Chloe, for that great answer. In conclusion, the question remains, should we say autistic person or person with autism as professionals in ABA? The goal of Person First Language is an admirable one. However, the communities involved need to have the most influence. As we've heard, the autistic community often prefers identity first instead. When serving clients, ABA professionals should be doing no harm and behaving in a way to protect the rights of their clients. One must continually be inquisitive, respectful, and open-minded in order to remain culturally aware and responsive. This means they must change with the times by looking at the community in which they are serving and what most of that community prefers. Ideally, asking the client would be the first plan of action. However, sometimes that's not possible. In these circumstances, ABA professionals should be consulting the client's stakeholders as well as the overall view of the autistic community at the present moment. Overall, both Person First and Identity First Language have the same goal, a sincere effort in respecting others. Listening to one's clients, stakeholders, and the voices of those in the community at large should be the default for any ABA professional. Always ask a client's preference of what language they prefer. Their voices need to be loudest. Thank you so much for coming to this debate. Here is our references, and we appreciate your time.